Hello and welcome. If you've ever been confused by the terms Medicare and Medicaid, you're not alone. Their names sound similar, but they're two very different programs. In this video, we'll explain what they are, who qualifies, what they cover, and the key differences. Whether you're a senior or caring for one, this guide will help you understand your options. Let's get started. So first, what is Medicare? Medicare is a federal health insurance program mainly for people age 65 and older. It also covers certain younger individuals with disabilities or conditions, like kidney failure or ALS. Medicare is the same nationwide, and once you qualify, you're eligible regardless of your income or assets. Medicare is made up of different parts. Part A covers hospital stays, some skilled nursing care, hospice, and home health services. Part B helps with doctor visits, outpatient care, lab tests, preventive services, and some medical equipment. Part C, also known as Medicare Advantage, lets you get Medicare coverage through private plans. These usually include everything in Parts A and B, plus extras like dental, vision, hearing, and sometimes prescription drugs. Part D helps pay for prescription medications. You can enroll in a standalone Part D plan, or get it through a Medicare Advantage plan. Medicare covers a wide range of healthcare needs, but it's not free. You may not pay a premium for Part A if you worked and paid Medicare taxes, but Part B has a monthly premium. You'll also have deductibles and copays when you receive care. That means you'll likely still have out-of-pocket expenses, even with Medicare. Now, what about Medicaid? Medicaid is a joint federal and state program that provides health insurance to people with low income and limited assets. Unlike Medicare, it's based on need, not age. Medicaid covers people of all ages, including children, adults, seniors, and those with disabilities, as long as they meet their state's financial and residency requirements. And because it's run by individual states, the benefits and rules can vary depending on where you live. Generally, Medicaid covers hospital visits, doctor care, lab tests, prescriptions, mental health services, and transportation to medical appointments. It often also includes long-term care like nursing homes and home-based services that Medicare usually doesn't cover. For most people who qualify, Medicaid is free or very low cost. There are often no premiums, and copays are either small or waived altogether. Now let's look at who qualifies for each program. You qualify for Medicare if you're 65 or older and either a U.S. citizen or legal permanent resident. You may also qualify earlier if you have a severe disability or specific medical condition. You qualify for Medicaid if you meet your state's income and asset limits. Each state sets its own guidelines, but in general, if you have low income and limited savings, you may be eligible even as a senior. And yes, some people qualify for both. These are called dual eligibles. If you're one of them, Medicare pays first, and Medicaid helps cover what Medicare doesn't, like premiums, copays, or long-term care. It's like having backup coverage that can reduce your out-of-pocket costs dramatically. Let's clear up a few common misconceptions. Some people think that turning 65 means Medicare will cover everything, but that's not true. Medicare still has costs, and it doesn't cover everything. You'll likely need to pay for Part B and Part D, and there are deductibles and co-insurance amounts you'll need to plan for. Another myth: Medicare will pay for long-term care. Not exactly. Medicare covers short-term rehab in a skilled nursing facility, but only for up to 100 days. It doesn't cover ongoing custodial care, like daily help with bathing, dressing, or eating. That's where Medicaid can step in if you qualify. Also, many people think you can't have both programs at once. That's false. If you're eligible for both, it's highly recommended to enroll in both to maximize your benefits. So let's summarize the main differences in simple terms. Medicare is federal, age-based health insurance. It helps with hospital care, doctor visits, and prescriptions, and you generally get it when you turn 65. Medicaid is state-run, need-based coverage. It helps those with low income afford not only regular health care, but also long-term support like nursing homes or home aides. With Medicare, you share in the costs. With Medicaid, most or all costs are covered for those who qualify. So which one should you have? If you're 65 or older, you should absolutely enroll in Medicare. But if your income is low, look into Medicaid. 2, even if you already have Medicare, being dual eligible means you can save a lot and access services you might not get otherwise. How do you apply? To sign up for Medicare, go through Social Security, either online at SSA, Gov, over the phone, or by visiting your local office. You'll typically enroll around your 65th birthday. For Medicaid, you apply through your state. Visit your state Medicaid website or call your local health department. Many states have online screening tools to check eligibility. You can apply anytime. There's no specific enrollment window. Let's wrap it up. Medicare and Medicaid are powerful programs that help millions of Americans, especially seniors, get the care they need. Medicare gives you access to essential medical services as you age, Medicaid is there to help if you're struggling to afford care, especially long-term support. Understanding the difference can save you money, stress, and confusion. So take time to review your eligibility and don't hesitate to ask for help. If you found this video helpful, give it a thumbs up and subscribe for more practical, friendly guides about health and aging. Leave a comment below if you have questions or want to share your experience. It might help someone else. Thanks for watching, take care, and stay healthy.